Welcome back to our second video on serology testing for the SARS coronavirus 2. And in this video, we're going to further emphasize how these tests can be used. We're going to review or spend a little extra time helping folks understand the difference between IgG and IgM and what a positive or negative test for those things may mean. And I think it's going to be helpful. This is probably the most exciting area right now for being able to deal with this pandemic, especially in our country, because in the absence of a treatment and in the absence of a vaccine, what we need right now is better data, and these serology tools are what are going to empower us with the information that we need. And I think that this will be helpful. So let's review this really quick again. So a person can be negative on this particular test that we're discussing right now. They could be IgM positive, they could be IgG positive, or they could be positive for both IgM and IgG. So what does a negative result look like? So if the negative result shows up, what does that mean? A negative result means that they could be in this range, right? We would assume that they're there, somewhere over here. So if you have a negative result, then there's a few things that could mean. One, it could mean you've never been exposed to the virus. And we would presume that you're therefore susceptible to the virus if exposed, and you could get sick and potentially be infectious to others. You may not even be developing clinical signs or symptoms and still be subclinical, but yet infectious to others. So if you have that test, a negative, you could potentially be in the same situation that many of us are probably in right now. Symptom-free and potentially virus-free, hopefully virus-free. Another option, you could be in this range where you are subclinical. You've been exposed to the virus, but you don't have antibodies yet. So the only way we would know for sure is if we actually measured the virus. You may be pre-symptoms, so you may be ahead of the actual symptoms. So you could potentially be subclinical, but yet infectious. So that is also what a negative result could mean. Another option could be you've been exposed before, but your immune system is so weak from maybe chemotherapy, age, a autoimmune disorder of some type, and medications you may be on. So there's different reasons why somebody else may be negative, but those are the options. What about being IgM positive or IgG positive? How can we use information about being IgM or IgG positive? If you're IgM positive only, then that means that you're probably in this range here. So you're looking at 7 or 8, maybe 10 days after symptoms appear, and your long-term antibodies haven't quite kicked in. So your frontline defenses, your first responders have kicked in. So if your IgM levels are high or even just present, but the IgGs aren't there, then that means that you might actually be right now dealing with the actual infection and your body's still trying to deal with it. There's the potential that somebody is symptom-free during that period and infectious. So if you have an IgG level, we assume that you've had long-term infection. If you have an IgM level and that's detectable by this test, I would imagine the clinicians are going to end up suggesting that you probably stay away from others, and if you actually have symptoms, you may be under some sort of surveillance or monitoring, especially if you're at risk for more serious health outcomes. All right, IgG positive, what does that mean? Well, these are the folks that if they're just IgG positive, then there may not be, no longer may be detectable IgM antibody. So if there's no longer detectable IgM antibody, but only IgG antibody, we may be way out past the actual infection, past the initial infection. and presumably no longer infectious to others. And if this is where people are at, if you are just IgG positive, those folks are folks that are in a unique situation. One, some people may be upset that somehow they've already got the virus before and they've gotten better, but irregardless of how they already got better or not, they could potentially re-enter the workforce. They could potentially, if they're healthcare workers, relieve frontline health workers that may be at greater risk. There's all kinds of benefits of being able to know whether or not somebody has the antibody and is theoretically immune to future infection by this virus and no longer able to spread the virus to other people. So it's a very powerful test. And then if they're IgM or IgG positive, they're in this range here. And that's a noisier picture. It means we probably need to wait a little bit longer to figure out whether or not they should re-enter the workforce or not. And I'm not quite sure, and I think future studies are going to be needed, that when they have both, if they're in this range here, are they potentially infectious to others? Future studies will need to determine that, to determine if the viral titers are high enough and the person is infectious at that point to others. But if you're just IgG positive, I think that you'd probably be, we usually would assume that they're entering the free and clear range and able to potentially re-enter the workforce. All right, so that's just a little bit on that test and how it works. So getting into the next aspect of it. So from the previous video, I put up Dr. Miller, Tyler's slides earlier, and I'm going to put up some more. They evaluated that actual test that I was just showing you, and they showed that it's pretty good at detecting IgM levels and IgG levels and IgG and IgM levels after 7 days. And it's got relatively good sensitivity, the ability to detect true positives. The specificity, the ability to detect true negatives, it was perfect. They didn't get it wrong at all. Every negative person, the test successfully identified them as negative, at least with the samples they had from their negative people. Now, they only had 33 individuals, or 33 samples, but it's still quite promising. After 7 days, it'd be nice to see these sensitivity values get a little bit higher. These sensitivity values reflect the actual report that I found from the actual company that was actually recently published in a peer-reviewed journal. Furthermore, we see here that at day 12, for all the persons under 80, the sensitivity was perfect. So people who are older or immunocompromised may not produce a strong enough antibody signal or have enough antibodies to allow us to be able to see an actual positive result for having the antibodies of interest. So good sensitivity after day 12, particularly for younger people. So that's very promising. Now, the actual authors responsible for the test that gives us these results, there was a group that actually reviewed this product, so we can learn about this particular product, and we see the sensitivity was 89%, and this included people of all ages and all immunological conditions. So good sensitivity and relatively good specificity. We would love to see these a lot higher. You'd like to see them closer to like 98 and 99%. Sensitivity is our ability to correctly classify a true case. Specificity is the proportion that is correctly classified as true negative. In this example, 88.66% was correctly classified as a true case. So that means about 12% of the actual cases were maybe, told, we didn't detect any antibody in you, so you're, you've never been exposed. And they may have actually been exposed. We don't know. So there's some challenge there where you would like to see this actually accurately characterize the true cases. I mean, these people are people that actually met the COVID-19 diagnosis criteria. They tested with the virus, and yet the antibody didn't show up. It could be that they had a weakened immune system, and that might be why they're older. The authors didn't provide detail on the ages of these 397 samples, nor did they on the 128. On the specificity, the proportion correctly classified as true negatives, these are people who we know weren't negative, but for whatever reason, they had some antibodies or something going on in their bodies that gave us some, reason to believe that there was some cross-reactivity or something. Not many, but there's a handful of them. 10 of 128 were IgM positive. And that just makes me curious as to what antibodies did they have that wanted to attach to the actual SARS coronavirus 2 antigen that was used. So why did those antibodies stick to it? And is that similar in China as it would be in the United States? It could be that there are other SARS coronavirus 2 like viruses out there that these folks have been exposed to in the past. So that's just a curiosity thing on my part, and it's kind of cool stuff. So this is how the test actually looks. This was Dr. Miller's image off of his Twitter account for that presentation that he gave to among his group with a group of folks. So you can see in this example where they took a positive case from their hospital, Mass Gen Hospital, and they saw this CGM pattern where C is our control. This line has to be solid so that we know that the test worked. And then this person also was IgG positive and IgM positive at the time when the blood or whatever blood sample was taken that then resulted in that test. These results are really promising. This huge company, most well known as BD nowadays, partnered with Biomedomics, and they actually are going to be able to make millions of these tests apparently in the next few months. 1 million in the month of April is what they apparently are able to do. And there are all kinds of labs right now around the country that have access to these tests, and they're trying them out and they're validating them. And the harm of having a test done is not nearly as great as the harm that can be done from giving somebody an antibiotic, or giving somebody an antiviral in the case of this virus, or giving somebody a vaccine. Those things are more reactive to what's going on in the human body. When you take a blood sample and take it out for a test, testing is not as worrisome. There's still big worries that can come up, and there's good reasons to validate these tests because you don't want to give people false hope or give health departments or medical professionals inaccurate data or inaccurate information. So you want to make sure that these tests work, because if the tests don't work, that can be equally bad. However, if the people know the strengths and the weaknesses and can use these tools complementary, they can help treat patients better, and from a public health perspective, we can do better surveillance across the country. So we're going to review here really quick, or I'm going to put these review slides up for you, and you can answer them maybe as part of a quiz or a homework. So I've got these questions here that you'll be going over, and for folks at home who want to just see the questions, I've got them up there. And this is a cool one, is which group would be the group most likely to be immune to infection and presumably now longer able to shed virus to people in a communicable fashion? And then, is the test to the right labeled negative indicative of being free of virus in their body? they're negative, do they have virus in their body or not? That's a tricky question because remember, this is an immunological or serological test. This is not a measure of actual virus. All right, so that's all for this video. I know this section was a bit more biology than what you may typically like, but you all had several courses in biology, and understanding IgG versus IgM and serologic surveys, and for us to be able to understand what's going on in the population, it's a very, very important tool, particularly in infectious disease epidemiology and understanding how to monitor an outbreak, or in this case, a full-blown pandemic. So hopefully this has been helpful. As you know from before, you can always contact me at jason.marion@eku.edu with any of your questions, and I will do my best to respond back to you in a very timely manner. I hope you have a wonderful weekend this weekend, and be well.